Come in.
Good morning, Mr. Charles and Linda. How are you? I'm so sorry to bother. My name is Suli. I'm a social worker.
I don't want to go anywhere. I want to go home.
I understand, yes. So that's exactly why I'm here. I primarily work on the discharge planning for patients. So I just want to do a little assessment, confirm all the basic demographics, and then talk about the discharge plan
All right,
once
but I
we're
already
cleared.
told you that I want to go home.
Okay.
My wife needs me at home.
I just want to confirm some basic demographics to make sure that I have everything correct. Can you confirm your date of birth for me, please?
1/18/1945.
Okay. And your phone number?
786-467-4534. I don't get confused with that.
And what is your address?
955 Southwest 162nd Avenue.
Beautiful. Is that Miami, Florida 33196?
Yes, it is.
Okay. And who do you live with?
My wife Linda.
Your beautiful spouse, Linda. Okay, perfect. And can you confirm your primary care doctor?
I don't remember his name. What's his name, honey?
I think
Dr.
you have
Steegers.
Okay,
Oh.
Dr. Steegers. Perfect.
Yeah.
Okay. And your insurance? You have Medicare Part A and B?
Yes, I do.
Perfect. Okay.
I worked all my life. I'm a retired professor.
Perfect. And I have Linda here as your emergency contact. Yes?
Yes.
Is that correct? Can you verify your phone number for me, Miss Linda?
786-467-2070.
Perfect. Okay. And Mr. Charles, do you have any medical equipment you use at home?
A walker.
You have a walker,
Use
okay?
it.
I use it.
Use it.
Sometimes.
I use it.
Okay. And no nurse.
It was an accident that I fell. I tripped on the rug. I already told
Get
you.
rid of the rug.
I'm just so clumsy
Get rid
now.
of the rug.
Yeah, and
Yes,
we're getting
get rid of the
that
rug.
rug.
I'm not gonna fall again.
And you did mention you didn't have any nurses going to the house because you guys
No.
don't like strangers
No,
going to the house,
stranger
correct?
going.
Okay.
No
perfect.
strangers.
Okay, awesome. Okay. So to my knowledge, Charles, I am aware that you fractured your femur. You were here previously and you went to an acute rehab. Is that correct?
Yes, it was an accident. I'm just a little bit more clumsy now. My walker got stuck and I fell down. I'm fine. I can go home. My wife needs me at home.
I completely understand. So I did want to talk about a couple of options just because I know you do help your wife at home, and I think that it would be beneficial for you to go to a facility so you
No,
can
I
receive.
already told you. I need to go home with my wife.
I understand your concerns and they're very valid. However, I do think that not only will this benefit you, but it'll also benefit your wife. You know, in order for you to help your wife, you need to become stronger.
She cannot be alone. She needs me at the house.
I help him.
Okay. I also
You're
have here.
blind. You cannot see.
I also.
You cannot be alone. You need me at the house.
But
So
you don't
I
even
can
use
help
your
you.
walker. You
I
don't
can
use your
help
walker.
you
I help
just
you.
fine.
So I'm so sorry to interrupt. I completely understand both of your concerns. I do have here that there's a child, Martha, who's willing to
Her
help.
child, she's grown already. She has her own family.
So, Mr. Charles, I completely understand with regards to Martha having her own family. That's completely valid. But I did speak to Martha. She did mention she was willing to help. At home while you're at the facility. So I did want to go over the facility
She's not
quickly.
gonna be with Linda all day.
I'm gonna be there.
And I don't want strangers
gonna
in my
be
house.
there.
I don't want strangers in my
I can
house.
be there.
I don't
Yeah.
want strangers in my house.
So I think.
And what about the kids? What happens when you have to go pick up the kids? She's gonna be home alone. You're gonna find
Yeah.
her on the floor.
You can watch. They
Martha
don't have
can
to
help.
touch.
Martha can help. I don't want
So-
strangers. I don't
So
want
I
strangers.
just wanted to go over the actual facility very quickly. It's not like the acute rehab. It is a skilled nursing facility, so it's short term. It is 3 to 4 weeks. The treatment.
3 to 4 weeks without me, honey.
The treatment.
What are you gonna
it's,
do?
Help
It's
Mom.
around 3 to 4 weeks. It always depends on the patient and their level of need and how they progress in the treatment. So it's an hour of physical therapy a day. Like I
Can
said.
I do that at home?
You don't do it at home. You
So-
don't even use your walker at home.
Mom
I
doesn't like
use my
strangers
walker.
in the house.
So
I don't
at
want
home, the
anybody coming to
physical
the house.
therapy would not be as intense as it is at a skilled nursing facility. At home, the nurses would go about 2 to 3 times a week, and it's really only 20 minutes. And for your level of care, you fractured your femur, I think you would need a bit more assistance. And with that level of assistance, you would recuperate even faster, as opposed to having a nurse only go like twice a week to
I
the
don't want
house.
anybody in my house.
Yeah.
Fine. Where are you sending me to?
So we would send
And you're
her.
throwing away that rug. I don't want it in the
I'll
house.
throw away the rug.
So, thank you so much for being so patient and listening to me. We will send the referrals to the agencies contracted with your insurance. So once I send the referrals, I'll provide you a list so you can look over all of the facilities and their reviews, and then you can pick around 3 options that you're most interested in, and we can follow up with them.
It has to be close to my home. She cannot drive. You're gonna bring her to see
Martha will bring me to see you.
Do you guys live within this area?
Yes.
Okay, we do have a couple of facilities in this area, so I can follow up with them as well to see if they accept your insurance.
And what if there's none?
So if there are no facilities
Then you just gotta
within,
drive her a little bit further.
yeah, if there are no
drive
facilities
me.
within the area, we do have other facilities that are a little bit further, but, you know, we'll follow up with these first. There's like around 3 around here that, you know, that I will follow up with first, but in the case that they don't have any beds or they don't accept the insurance, we will move on to the other facilities that are a bit further. But for now, let's try and focus on the ones that are here and if they accept the
I
insurance.
just feel so bad. Like Dad. Like I don't know.
Can I
are
stay
Are
with
you
Charlie?
are you okay
Can I
with us
stay with
doing
him?
this? I don't want to take away from like your independence. I feel like you've always been so strong and you do all these things by yourself. Are you sure you're okay with this?
Well, you guys are saying I can't go home and that I
I
need
just
more
feel
help.
bad. I just feel bad.
So
You get
let me just
confused
go. I'm gonna
sometimes.
get stronger
I-
so that way I can be with my wife and help her out.
I agree.
You
I-
get confused sometimes.
So the facilities have nurses and doctors there that can assist with any medication management if that's a concern. I do think that, you know, going to the facility, he will get stronger, and that way, you know, you can go back to golfing. I know you like to go to fitness centers. You can do all of that. Okay. Do you guys have any questions for me?
Send me away.
No, I just feel bad.
And then I'll get back to you guys once I have a list of facilities, okay?
Alright.
Well, if you need anything, my name is Suli. I'd be more than happy to help you again.
Thank you, Suli.